Thank you. All right, well, I have 9 minutes, so I'm going to go fast. And in order to rethink healthcare, I think it's important that we actually put the health in healthcare, because I think it's missing. And I want to share a Chinese proverb that says, the superior doctor prevents sickness, the mediocre doctor attends to impending sickness, and the inferior doctor treats actual sickness. I think if you look at our healthcare system, it looks a little bit like the latter, a little too much like the latter. So in order to sort of outline how we rethink healthcare, let's talk about the problem a bit. This is CDC data on obesity per state. The darker blue is 10 to 14% of that state being obese. I'm going to cycle through the next 20-some years and show you what we've done in this country. So we're just creating new colors. Paint our country. And Colorado, it joined us in 2010. So we have major issues with obesity tied to cancer and diabetes and heart disease. Diabetes, much the same. In the early 90s, relatively flat prevalence, skyrocketing prevalence now over the last 20 years. This is not health, okay? Trying to find the medication that fixes the disease is not health. Because when you add the medication, it doesn't deal with the root issue. So we wind up adding more medicine. We add more medicine and that doesn't work, so we tell patients they have a design flaw and their stomach's too big and we need to bypass most of that stomach and shrink things down. The health system, unfortunately, drives this disease management, this sick care. We have reimbursement systems tied to high volume of patients and procedures. So physicians are not incented to improve wellness and improve health, and they're not equipped for that discussion either. The average physician sees about 30 patients a day. And when you factor in lunch and charts and doing some messages, they get about 7 minutes per patient. There's not much you can do in 7 minutes outside of write a prescription or refer to a specialist. And so we've got a major problem in the healthcare system, not just in the physician side, but also on the structure, on the model. And because of this 7 minutes and because of this high volume output that we need from physicians, the physician-patient relationship looks more like a general telling a soldier what to do. Here's your order, follow this order, or be deemed non-compliant, and now you're out of my practice. And I know, because I was there, I was on both sides. I was the obese patient, and I was the 30 patient per day family doctor. 30 patients was a good day. It was a light day. And what took a small change 7 years ago to just lose a couple pounds became this major transformation in what nutrition holds, what nutrition can do. And I had to actually go back to school to figure that out because I got about 15 minutes of nutrition in my 7 years of medical training. And so I studied Michael Pollan, Omnivore's Dilemma, and learned about whole foods and learned about the downsides of the industrial food that we're eating, how we need to eat real food and avoid the processed and refined and genetically modified and horribly raised food-like products that we're so heavily surrounded by in our grocery stores and restaurants. I trained under Dr. Andrew Weil in Arizona and learned how to create healing alliances with patients, how to partner with patients and work with them and meet them where they are to help them understand what's happening with their disease process and how to tap into the body's amazing innate response to heal. And so I define health very differently. To me, health is preventing disease. It's promoting health and preventing disease. It's not managing a disease. It's not following a number and doing everything you can with your prescription pad to get that number down. It's about vitality. It's about feeling well, being great. It's not the absence of disease. It's about relationships and connection, not just relationships with the patient and the provider, but relationships with the patient and everybody else around them. And it's empowering. Patients need to be empowered to take control of their health because they're the only ones who truly are invested in their health. And they're the ones that need to know what the best ways to go, what the best things to do are. Shouldn't our healthcare system align with this definition of health? And in order to do that, you need a healthcare system that creates a culture of health, that brings these things together, that, again, promotes health and talks about the prevention of such and the lifestyle factors that are tied to those diseases or those conditions. It's connecting and creating relationships, not just in the patient visit, the office encounter, but how do you create relationships outside of that? and it's educating patients and empowering them to take control of their health. So I started GladMD Integrative Medicine almost 2 years ago, and I call it the high-tech, high-touch practice. I spend an hour with patients, and it takes at least an hour to learn about who they are, what their goals are, where they've been, and to be able to meet them where they are on the path to nutrition or stress management. We use a lot of social media because, again, it's important not just that hour I spend with them, but now the relationship as it extends beyond that, and use the Twitter and Facebook to post different articles and different messages that they're going to relate to them and help them on their journey. I do a lot of video conferencing and email. I mean, I came out of medical school and I took care of my friends and family on email. Kept them out of ERs and kept them out of urgent cares. Well, why can't I have that relationship with my patients? And so I use a platform that allows me to connect with patients that way. I give patients full access to their records. Those are their records. That's their information. And they need that to empower themselves to track and trend some of the important data points that we find. And I'm insurance-free because insurance, again, promotes a high volume and a high number of procedures. I want to work with patients and work for patients, and so I've left that venue. We look at the body as a house, and the premise of our healthcare is not a lot of high-tech testing and a lot of imaging. It's talking about the foundation of health. If you were looking for a house, you'd make sure the foundation was rock solid, and your health is no different. Digestion, stress management, whole foods eating. This is woven through every visit and every interaction in our healthcare, and it's essential to make sure that the foundation of your health is solid too. And we see lots of success, lots of fun success on nearly a daily basis. This is a gentleman who was in his mid-50s and clearly had diabetes in December. He had a fasting blood sugar of 161. His hemoglobin A1C, which is supposed to be below 5.7, was 7.9. And we spent an hour and multiple emails talking about nutrition and the right approach to eating real food. And in 4 short months, he no longer has diabetes. His fasting blood sugar is 96. His hemoglobin A1C is 5.2. It's the power of nutrition. It's a lady with multiple autoimmune diseases who's been told by her gastroenterologist that she needs a liver biopsy and that she needs heavy anti-immunologic drugs to shut down the immune system. And you can see her liver enzymes are elevated beyond the normal range. Her inflammation marker, which is really one of the more important markers to know, was through the roof at 22. And her lupus antibodies, lupus is a major autoimmune disease, was so high that you couldn't even register a number. And through nutrition and healing the digestive system and focusing on a lifestyle that calms the immune system, she did just that. Her immune marker is now normal at 4.4, her inflammation marker rather. Her liver enzymes are almost perfectly normal, and her lupus antibody number is normalizing, and it's probably normal at this point. To go from too high to detect to 1.64 is quite impressive. Had an 18-year-old who suffered from chronic pain, muscle spasms, nerve pain. 18 years old, not going to school half the time because she's in an ER in the hospital. And we sat down and talked to her and learned her story and healed, again, the digestive system, worked on that foundation, talked about the right nutrition to get her body back on track, and she's relatively symptom-free. She's completely medication-free. And her mother has evaluated her health progress based on insurance claims. In 2009, there was 147 insurance claims, ER visits, labs, medications. In 2010, 95. And in 2011, combined with 2012, 0 insurance claims. So talk about an investment in your health. So how do we rethink healthcare? It takes listening. It takes listening to patients, listening to others, and it takes time. It takes connecting with patients and changing that relationship from soldier general to partner. And it takes knowledge. It doesn't have to be a physician. It could be any healthcare professional who understands the value of those core principles. Thank you.